All right, everybody. It is the top of the hour. Happy whatever day it is, Thursday. I almost said Monday. Oh my goodness. Happy Thursday. Hope everyone's having a nice week. We are really excited today to share with all of you our latest consumer insights research. And this is meant to be an informal presentation in the sense that I will walk through our latest research for about 15-20 minutes and then leave some time for Q&A at the end. But this really is the start of a continuation of the Root Cause Coalition's efforts to build out our research portfolio on consumer insights related to health equity and social determinants of health. And we really feel like this is a critical piece, not just for education and awareness, but also for the advocacy work that so many of us do. And these insights can really be used to help inform our work, our policy work as well. So if anybody has questions throughout, please feel free to put them in the chat and I will try to address them afterwards. And then we'll also open up the line for Q&A after these slides. Also note that these slides are available to everyone. Well, you can either send them through email and they're also available on the Root Cause Coalition website under both news and events and our research page. So welcome, and I will dive in. So this, like I said, this is the start of a series of research projects that the Root Cause Coalition is doing. This research was fielded in April, so it's very, very new, and expect to see additional reports coming out of the coalition for May, June, and July on similar topics related to health equity, the cross-section of COVID, social determinants of health, and other related issues. So with that, I will dive in. Okay, so our first question, and I wanted to note that some of these will be tracked. We're doing these monthly surveys, and a couple of these questions are really important, I think, to track over time because they are changing so quickly. So just as a quick reminder, this survey was fielded last month. And when we asked, have you had COVID? This was the very first question in a 10-question survey. About 1 in 10, 11% say that they have had COVID. 85% say that they have not. And this will be a question that will continue to track and trend over time. Okay, so this vaccines, of course, it's a really, really important issue right now. And we wanted to get a sense as of April, who had been vaccinated. This survey was 1,000 individuals, 18 plus, nationally representative in terms of age, gender, region, income. And so we can dive into the demographics if anybody's interested afterwards, or also in the back end of the slide deck that's available to all of you. But this is just a general sense of the findings where you see 45% as of April said that yes, indeed, they were vaccinated. 12% said that they have an appointment and they're waiting for their vaccination date. Yes, but I don't want to be vaccinated now in terms of I've been offered, but I don't want it. That was only about 7%. And then you can see 17% say no, but I'll get vaccinated when it was offered to me. And then the dark blue, 16% say no, and I don't want to be vaccinated now. So if you add up the 16% and the 7%, you get to the 23% who report not wanting to be vaccinated as of April 2021. Hopefully that number will go down over time. Okay. So we also wanted to get a sense of comfort levels. So obviously all of us are going through this. This is not unique to this survey sample. We wanted to get a sense of what feels safe or comfortable once you're vaccinated. So you can see this long list of options here, and thanks to Root Cause's research committee for helping develop the questionnaire and these lists as I talk through them throughout the survey. But you'll see here the dark blue, the dark green represents feeling completely safe. The lighter green is I feel somewhat safe. So if you look at the first row, going to the doctor or healthcare professionals in person, about 40% say they feel completely safe. But if you add up the 40 and the 46, you see about 86% saying that they feel, at least somewhat safe going to the doctor. You can look down the list. Some of them are pretty interesting. I think about a third say that they feel completely safe going grocery shopping. Only about 1 in 5 say that they feel completely safe eating inside a restaurant once they're vaccinated. And then you can see down the list, fewer percentage say that they feel completely safe flying in an airplane, going to the gym, taking other forms of public transportation, for example. And you can see at the bottom, taking other forms of public transportation. I think this has equity implications as well, where you can see 27% in that dark blue report feeling very unsafe. So about a quarter of those who were surveyed. Okay, so then we wanted to ask a little bit about equity as it relates to vaccines. And obviously this was more of an issue in the first couple of months of the vaccine rollout, where I'm in Washington, D.C., and it really was really tough to get a vaccine, as it was in many, many states, if not most. So we wanted to get a sense here, how would you personally distribute the vaccines? Would you give preference for communities with higher numbers of total cases? Would you not give preference? Would you give preference to communities with lower cases? And so you can see here, over half say that they would distribute or give preference for the COVID vaccine to communities with higher total cases. And I think that speaks to the sentiment around equity. And I know that in DC, they did prioritize based on zip code and total number of cases. So it did kind of pan out that way here in Washington. All right, so the next two slides, think of them as kind of a partnership set of slides. We wanted to see here, who did you rely on for information about the COVID vaccine? I think this is really interesting. So look at the first three bars. So 25%, about a quarter, say that they relied the most on CDC. About 1 in 5 say that they relied on their healthcare provider or doctor. And then this really high, 19% said they relied on television news, and then only 8% family and friends. And you can look down the list. Obviously, the numbers are a little tricky because 5% report federal government and CDC are viewed as separate in this case, but we know they're obviously linked, practically linked. And then only 6% are reporting social media, which I think is an interesting finding as well. Okay, so now look at this. So that was reliance, this is trust. So 33%, about 1/3, ranked number one as trusting the CDC. To me, that's not really surprising. About a quarter say healthcare providers and doctors. So 1 and 2 are the same as the reliance slide on the previous slide. But then you see family and friends, about 10%. That's a little bit higher than the previous slide. And then look how television news drops off. So we saw nearly 20% in the previous slide relied on television news, but only 5% are reporting that they trust that source the most of all these sources. So a little bit of a disconnect there. Okay, now I think we get into a little bit more about behavior. So we wanted to see behavior and impacts, right, on COVID. So we wanted to see what did you do or not do over the past year plus, and then what impact did COVID have on you or your family over the past year plus. So we see here 33% say that they did not go to their routine doctor's appointments. I'll be interested to see as we look at that question over time and as that comfort question may change, whether or not the feeling completely safe percentage goes up about going to the doctor's appointments, and whether or not going to routine doctor's appointments goes up pretty significantly once vaccinated. We also saw that 26%, so over a quarter of those surveyed said that they've had a decrease in salary or income. And then sadly, I think 1 in 5, about 19%, say that they've had trouble paying their bills and also not going to the doctor when they felt sick. So really here, this sort of stark reminder about the impact of COVID throughout the past year. And then building on that, so not just behavior, but how did you feel about the past year? It's pretty scary, right? But it manifested in different ways. So we wanted to know whether or not people had these emotions and kind of how often people had these emotions. So I felt comforted by family and friends. That was by far sort of the emotion that people felt, where you see that 50% plus the 39%. So 89% say that at least some of the time they felt comforted by family and friends. And then you see this very high percentage also saying that they feel concerned about the future. I think interestingly, this survey was fielded in April, so it's a good reminder on the timing, but you have a similar percent also saying that they feel optimistic about the future. and a not dissimilar or significant difference in participants saying that they feel happy or joyful. You also had quite a bit saying that they at least sometimes felt isolated or lonely or worried and scared. So again, it'll be interesting to see how this changes over time, but I think it's a nice reminder, regardless of who you are, where you are, the feeling of being connected or comforted by family and friends, and then that isolation and loneliness kicking in as well. Okay, so the last couple of questions have to do with volunteering your time or your money over the past year. And again, think of this slide as connected to the next one, where we asked, over the past year, did you volunteer your time or money? And we see here nearly 40% say, yes, I donated money. And when you look at the demographics, which we can go into if anybody has questions, this obviously goes up with higher income individuals. And then 16% say, yes, I volunteered my time. That was pretty mixed, but it did skew towards a lower age group. And then almost half say that they didn't volunteer their money or time. And naturally, the next question asks, gets into why. So we asked as this follow-up, if you did say that you donated your time or money, why did you? And here you see nearly 60% say that it's something that they did before COVID. But I think maybe more interesting is this finding that nearly 40% say that the impact of COVID led them to volunteer their time or money. You see about a quarter of individuals say that they had the financial stability to do so. And then 16% say that they found themselves with extra time to volunteer. So again, it'll be interesting to see, as we elevate, as the health equity issues have been magnified over the past year, I think more and more individuals have been driven to donate their time or money as they're able. So again, an interesting question to track over time. And like I said, our May, June, and July surveys will continue to look at these questions. Okay, so that's it. There are a lot of demographic slides, which I can go into. I will stop there and let folks unmute themselves. If you have questions, I'll also look in the chat. But happy to take any questions at this time or answer questions about future surveys as well. So thank you for letting me share these slides. And let me know too if you have any questions about the demographics. Hearing no questions, and please chime in if you do. I can walk through some of the more interesting demographic findings very quickly. This slide, I just wanted to point your attention to those who report know they have not been offered a vaccine and they know they don't want it now. And as you can see here, so just to orient you when you're looking at the slides in the future, the red means that it's significantly less than the total, so kind of drove down that total number, and the blue means that it drove up the total number. So for example, in that first column, when you're looking at the yes and I'm vaccinated, it's not surprising that the 65 plus group, 70% report being vaccinated. So it drove up that total number of 45%, which is in that top left cell essentially. So when you look at the no, and I do not want to be vaccinated now, which is from the second most right column, you see that less than 40,000, earning less than 40,000 per year row is the blue 23%. So that percentage is driving up that total number as well as the non-college educated. So as we think about campaigns to get individuals vaccinated, those percentages I think are important. We'll go to the next slide. Here we see, I'll just highlight a couple on this slide. For example, the blue in the working inside with other coworkers, you can see that the under 45 demographic feel safer than other age groups in terms of working inside with other coworkers. I don't think that's entirely surprising. And then you can see college educated versus non-college educated in terms of the taking other forms of public transportation. The college educated demographic feels more safe taking forms of public transportation compared to the non-college educated. In terms of COVID equity, you can see here cases with where you look at the first row, communities with higher total cases. 70% of those under 45 say that the vaccine should be distributed with preference to those communities with higher number of total cases. So it's interesting that the younger demographic feels more strongly about that than the older age groups. I will skip this one. I'll stop here. What happened? What impact did COVID have to you individually or to your family over the past year? And you can see here, in terms of not going to routine doctor's appointments, nearly 40% of college educated individuals report missing their routine doctor's appointments, which was less than the non-college educated. And then also in terms of decreased salary, it was more so from those who were under 45 and those who were college educated. Same for, I've had trouble paying household bills. It was higher for those who are under 45. So I'll stop there. Let me just look in the chat. I see one question. What would you say is the greatest takeaway from this research? I think there are a couple things that I would take away from this, and they're related to COVID, right? In terms of comfort levels, people are still anxious about their normal routines. So we'll see how that changes over time. I think there is at least self-reported sense of duty around getting vaccines into the communities that have the highest cases. So there is this sentiment around health equity, which is, I think, widespread. And then just in terms of the impact, right? How do we target equity related initiatives, other programs and services that individuals need over the next year to kind of meet their basic needs, and who is impacted. So I think this really has strong implications, both from a policy perspective, but also from a programmatic lens in terms of who do we target, how do we message, and then how do we track this data over time. And I think that probably answers your last question in terms of how does this research fit into the greater interests and goals of the coalition. Of course, the pillars of the coalition are advocacy, education, and research. And I think this fits squarely into all three in terms of both raising awareness, but also driving policy change. And someone has a question about the area where and the number of people surveyed. It was a N of 1,000, and it was nationally representative across states. So if you're interested in the specific breakout, it's at the end of this deck as well. I think I can get to it. There we go. So there are the sample sizes in terms of the breakout by region, at least. So each demographic is I think large enough to draw some conclusions. Some are smaller than others, but it should be representative at least, and we'll track it, like I said, to see how next month aligns with this one for at least a couple of the questions. I think I'll stop there. If I missed anything, or if you have any follow-up questions, by all means, let me know. You can find me at alexandra@rootcausecoalition.org. Please reach out anytime. And if you have other ideas for research, we will continue to do these monthly surveys, and we'd love to hear from you in terms of your ideas and interests. So thank you very much for your time today. And please join next month as you're able. Thanks so much.